Hello, I'm Alvin Glasgold, founder of the Glasgold Group for Plastic Surgery. Obstructed nasal breathing is such a common problem, and patients often ignore it. Yet, the solution may be quite simple. That's why today I'm going to teach you Nasal Function 101, a brief description of what you need to know about obstructed nasal breathing and how to treat it. There are three major structural issues that can produce obstructed nasal breathing. These are the turbinates, the nasal septum, and the nasal valve. First, the turbinates. The turbinates are projecting shelves containing the nasal humidifying system. When exposed to various environmental factors, these can enlarge and produce obstruction. They sometimes become chronically enlarged and block the nasal airway. If the obstruction is relieved by a decongestant nasal spray, it is likely due to enlarged turbinates. The second is the septum. This is the wall that separates the right and left nasal cavities. If it's deviated and projects into one of the other nasal passages, it can produce obstruction. If it's always a one-sided problem, it's generally caused by a deviated septum. This is a surgically correctable problem. The third factor is the nasal valve area, which is the narrowest portion of the nose, located at the nasal crease. A common cause of narrowing of the nasal valve is prior surgery, which can reduce this space. Nasal valve narrowing can be easily diagnosed by using a Breathe Right nasal strip, which will open the nasal valve and improve breathing. The most common problem is turbinates, which react to environmental factors, enlarge, and produce obstructed breathing and sometimes sinus symptoms. Enlarged turbinates may be treated with various topical nasal sprays and even oral antihistamines and decongestants. These work by shrinking the soft tissue of the turbinates. When they are chronically enlarged, a simple intraturbinate steroid injection in the office can produce long-term control of the problem and eliminate or reduce dependency on medication. A septal deviation is readily corrected by surgery that straightens the bony cartilaginous wall. This procedure is called septoplasty. If rhinoplasty is also being performed, septoplasty will be done at the same time. The nasal valve, when compromised, can be surgically corrected with either cartilage grafts or a suspension procedure. Cartilage grafts may be taken from the septum and placed in the nasal valve area to spread it apart and hold it open. Alternatively, a nasal valve suspension procedure is 90 to 100% effective and a simple operation to undergo. The results are generally permanent. A consultation would allow us to diagnose your problem and discuss your options.